Eligibility criteria for hearing impairments. To qualify with a hearing impairment, the individual must have an audiological exam for documentation of either a bilateral or unilateral hearing loss. This documentation must show an adverse effect on the development or educational performance of the individual. The effects on development and maintenance in the following, such as verbal communication, expressive or receptive language, academic and vocational performance, social or emotional competence, or adaptive behaviors. There are two classifications of hearing impairment: deaf, greater than 70 decibels of hearing loss with severe oral speech and language delay, or hard of hearing, losses between 25 and 70 decibels. These individuals will benefit from amplification, and they will communicate primarily through spoken language. Hearing losses can be divided into two types: a conductive hearing loss, which is due to dysfunction of the external or middle ear, and a sensory neural hearing loss, which is due to cochlear or auditory nerve malfunctions. To qualify as hard of hearing, the individual's hearing loss needs to be greater than a 25 decibel loss. However, the individual with a loss of less than 25 decibels may still experience difficulties in the classroom. Characteristics of a slight hearing loss. This hearing loss is associated with middle ear infection. It is a 15 to 25 decibel hearing loss. The individual will have difficulty hearing faint or distant speech. Any child with a cold or ear infection will have a temporary slight hearing loss. The individual will miss up to 10% of speech when the teacher is more than 3 feet away or the room is noisy. The student should be seated close to the teacher or speakers if the room has a sound system. A child with a slight hearing loss will have more difficulty hearing the teacher when on the playground or in the cafeteria or PE, art, and music classes, because the child's hearing is further compromised by a noisy environment. To simulate a slight hearing loss, put your fingers in your ears. What you hear is what a child with a slight hearing loss hears on a daily basis. Many times, children with a slight or a mild hearing loss are misdiagnosed as having attention deficit disorder. The characteristics of a mild hearing loss are 20 to 40 decibel hearing loss. This type of hearing loss is associated with chronic otitis media or ear infections. A chronic refers to the ongoing or frequent. These individuals will have difficulty hearing distant sounds or soft speech. They will miss 25 to 40% of speech at typical conversational loudness. The classroom discussions will be very difficult to follow. They will also experience difficulty to hear faint or distant speech. They may not hear you call them in from recess. This type of child may need the sound turned up to watch movies. On the other hand, they may lower their voices when speaking because they are trying to regulate their own sound. Many children who have had multiple sets of tubes may have scarring on their eardrums, which often result in a permanent slight or mild hearing loss. Do not assume that the child is just not paying attention. The behaviors you see may be the result of frustration because they are unable to hear what is going on in the classroom, or they do not feel comfortable asking for clarification. Children with a slight or mild hearing loss may rely on lip reading to supplement their hearing. They may not be able to tell you this because they may not even realize they are doing it. Do take special care to face the child when you are speaking. These children may follow all directions one day and be totally confused the next. Remember, if a child also has allergies, they may be fine in the morning and more congested after recess. which could increase their functional hearing to a moderate level loss. Every time a child with a slight or mild hearing loss gets a cold or suffers from allergies, the hearing loss may increase to the moderate level. The characteristics at this level are a 40 to 65 decibel hearing loss. It will affect their ability to hear even loud conversation without some kind of intervention. They will miss almost all conversation. Group activities will be a challenge, and their speech is noticeably impaired. A child with a mild hearing loss in both ears may encounter as much difficulty in listening as one with a moderate hearing loss. The characteristics of a severe hearing loss. This loss is between 65 and 95 decibels. Individuals cannot recognize many words or even loud conversational speech. They may have difficulty detecting environmental sounds, or they may be able to detect them but not be able to identify them. Speech is not always intelligible. A profound loss is a loss of 95 decibels or greater. These individuals may hear loud environmental sounds without amplification. They cannot hear conversation at all without aids of some kind. They will have little awareness of tonal patterns. They may not comprehend speech without visual input. Their own speech may not develop. Children who have a severe or profound loss will be taught American Sign Language. Those who use American Sign Language will have difficulty with sentence structure because their language is different than the standard English. The educational interventions for all individuals with a hearing loss. Instruction should be concentrated in vocabulary, language, phonics, English sentence structure, and written language.